Has anyone ever told you to eat things high in calcium while eating foods high in oxalate to prevent kidney stones? If you haven't heard of this before, there is a theory out there that says you can use this strategy to encourage calcium to bind with oxalate in your gut instead of in your kidneys. But does it really work? Stay tuned as we dive into the research to find an answer. Hi, I'm Joey Weichman, and welcome to Stone Relief. In today's video, we're going to explore a concept of eating high amounts of calcium with foods that are high in oxalate in an attempt to encourage calcium to bind with oxalate in your intestinal tract or your gut instead of this happening in your kidney, which leads to kidney stones. So if you've had kidney stones before in the past, you're likely aware that calcium and oxalate, when they're present in your kidney or in your urine, they're going to get together provided there's enough time and presence of these materials to bind together to form kidney stones, which is not a good thing. However, this theory that we're looking to explore today says that you can eat high calcium foods with high oxalate level foods, and it will bind in your gut and just get excreted through your waste or your feces. So an example of this would be something like eating cheese on a salad or drinking milk with mixed nuts, or just concurrently high calcium foods with high oxalate foods in an attempt to get this binding to occur in the gut. However, knowing what I know about digestion and nutrition, there are a few potential issues here that we're going to need to explore in today's video. First of which is going to be that of absorption rates between calcium and oxalate. Second, we're going to take a look at calcium quality and the role that that plays into it. And then also, what role does our level of oxalate intake play in this whole scheme of things of where calcium and oxalate may bind. So the first place that we're going to dive into is investigating the absorption of both calcium and oxalate, these two materials that we're investigating. The first place that I want to start is just identifying the different types of oxalate that are available out there. The first type that we're going to take a look at is the soluble oxalate, which means that it is not bound to any other type of element and it is free and it can float in and out throughout your body in different systems. So this is what is going to be absorbed by your digestive tract. So when you ingest something, it goes into your stomach, your lower intestine, and eventually your colon as well. And eventually it is going to end up in your bloodstream and then in your kidneys. So the stone-forming form of oxalate is going to be soluble. The next different type that is available is insoluble, which means it is already bound to something. It could be bound to something like calcium or another type of mineral. That means it is not able to be bound with anything else. So this type of oxalate is not something that is going to be binding with calcium in your kidneys to form kidney stones. More likely though, it is going to be absorbed in the digestive tract, or it's already coming in pre-bound with another element and is just going to get passed through your feces or your waste because, again, your body doesn't know what to do with it. Lastly, it's taking a look at the speed of absorption. And this is really where things start to pull away from this theory of eating high calcium with high oxalate foods and things binding together, because they don't absorb at the same rates, which instantly creates a problem. So oxalate, based on the research that we found, oxalate works its way through your system over the course of multiple days. And a big part of the reason that it takes so long is because your body doesn't really know what to do with it. So it just kind of gets shuttled all over the place until it finds somewhere that it can actually get excreted out of your body, whether, again, that's in your digestive tract or through your kidneys and your urine. But when it comes to calcium, your body does recognize, and this is something that has moved through your system relatively quickly. Calcium only really ends up in your body for about 2 or 3 hours before it's ported off to different areas and used for different processes in your body, which makes sense. Calcium is an essential mineral. We use it for a lot of different things in our bodies. It's going to get used up right away, where again, as oxalate is a waste product, we really don't know what to do with it. So again, right here, this theory already starts to come into a little bit of a challenge state because the absorption rates are not the same. So trying to eat these things at the same time really doesn't quite make sense, but we're going to continue to keep digging. Another factor to take into consideration are probiotics rather, good bacteria that can be found in our digestive tract that actually help us with kidney stones. Now, this is a rather new and kind of burgeoning field of kidney stone research, but probiotics' influence on our gut, or just like good bacteria and also bad bacteria, has an influence on kidney stones, interestingly enough. So there is a bacterial strain called Oxalobacter formigenes, and these actually degrade oxalate in the gut. However, it is not consistently present across the entire human population, so there is a small subset of us out there that do have higher level of these in our gut, and this will also play a role in absorption because it's going to tamper with oxalate and it can actually delay it or get rid of it, whereas if you don't have these present in your gut, you aren't going to be dealing with those same type of obstacles.
Just a reminder, this information is available in written form on our website. Find the link below in the description.
Next, let's investigate urinary excretion of oxalate, because this is really kind of where the rubber meets the road when it comes to kidney stones. So on average, 600 to 1,000 milligrams per liter of calcium is going to bind with roughly 88 to 264 milligrams per liter of oxalate. This is trying to establish a little bit of a binding ratio, if you will. So what this means is that calcium in the level that we intake has the ability to influence the amount of oxalate that we excrete. So if we use a baseline figure here, we're going to use 1,000 milligrams of calcium, which is the recommended daily allotment for calcium, or the RDA. So at 1,000 milligrams of calcium consumed on a daily basis, we're going to have 2.7 milligrams of oxalate excreted in your urine for every 100 milligram of oxalate that you consume. So again, at 1,000 milligrams of calcium, you're going to get 2.7 milligrams of oxalate excreted in your urine for every 100 milligrams of oxalate consumed. Now, what happens if we're looking at a calcium deficient situation? Because most people, especially here in the United States, are calcium deficient. So let's knock this 1,000, let's cut it in half down to 500, which is roughly where most of the population sits, give or take 100 milligrams of calcium. So if we're looking at 500 milligrams of calcium, you see some numbers change here. So instead of 2.7 milligrams of oxalate being excreted, we're now looking at 5.4 milligrams of oxalate excreted for every 100 milligrams of oxalate consumed. So as you can see here, calcium is playing a role. The more calcium that you eat, the less oxalate that you're going to excrete in your urine. And this is ultimately where this whole theory really kind of stems from. They say, eat more calcium, excrete less oxalate. And this, at the end of the day, is proving to be true. However, the timing of the strategy of eating calcium with high oxalate is really kind of irrelevant. It's more just centered on make sure you're getting the amount of calcium that you need, and then also not ingesting more oxalate, which we'll talk about here in a second, than you need to. But this is really kind of where urinary excretion starts to play a role, because again, calcium dictates how much we are going to excrete in our urine. So just to kind of give you a perspective on what this all means. So at 25 milligrams per day of oxalate excretion, that is going to be measured in something like a 24-hour urine test, this is indicative of a higher level risk for kidney stones. And to kind of broaden this perspective a little bit more, at 40 milligrams per day excretion of oxalate, this is what defines or partially helps define primary hyperoxaluria type 1. Now, this is a rare genetic condition where your liver actually overproduces oxalate on its own without any outside influence from food or anything else. So in this condition, people with primary hyperoxaluria type 1 tend to form a lot of kidney stones very, very fast, and they are calcium oxalate as of nature. But as you can see here, 40 milligrams and variation between 25 milligrams is not that great, and it is highly susceptible by the amount of calcium that you're intaking on a daily basis. All right, so let's wrap this up here and then decide whether or not this whole theory of eating calcium-containing foods with high levels of oxalate foods has any merit whatsoever. So as we've talked about, when it comes to absorption, that's kind of broken already. So when it comes to eating calcium with high oxalate foods, the timing is really irrelevant. However, calcium is important. So calcium with the oxalate is not going to be a reliable strategy in terms of timing. However, it can reduce stone risk. But again, We're not after decreasing dietary calcium here, because calcium, as we saw over here, the higher the amount of calcium that you consume on a daily basis, the lower the level of oxalate that you're going to excrete. So making sure that you're getting adequate amounts of calcium, hitting minimally that 1,000 milligrams per day, which is the RDA. However, there are some other things that we need to focus on with this, because calcium quality is also going to play a role with this. So what you need to do is you need to focus on high quality, bioavailable sources of calcium, ideally from whole food sources. Now, majority of this is going to be from things like dairy and cheeses and meat. You could possibly get some calcium from like a bone broth type of situation. But again, the quality of this makes a difference, because when your body recognizes, i.e. it's bioavailable, it puts it to use and it doesn't end up as a waste product in places where it can bind with oxalate and form kidney stones. And that's what happens with synthetic calcium. Our body does not recognize synthetic forms of calcium very, very well. So instead of utilizing it and putting it to work, it more often than not just shuttles it off into our urine to get excreted out of our body, because again, it is a waste product. It doesn't know what to do with it. And just because our body doesn't know what to do with a synthetic form of calcium, it doesn't mean that this synthetic form of calcium can't bind with oxalate. And it does very, very often. So if you're eating a lot of synthetic vitamins or vitamins with calcium from non-natural sources, and you're having kidney stones, and you're still eating oxalate in your diet, this may be potentially a source of your calcium that's binding with the oxalate. So be very, very cautious and conscientious of eating the bioavailable forms of calcium, ideally again from whole food sources, dairy, milks, meats, bones, things along those lines. And again, decrease oxalates if you're looking to decrease your risk for kidney stones. Calcium, you can go all across the board. You could eat thousands of milligrams of calcium every single day, but if your oxalate intake is still very, very high, you're still putting yourself at risk for kidney stones. So lower your oxalate to decrease your risk for kidney stones. If you'd like to join a community of men seeking to avoid surgery and prevent their kidney stones naturally, visit our website. See you in the next video.